Sir, we are live now. You can start.
Okay, thank you. Good morning to everybody attending this session right now. From this side, it's Dr. Hamza. I'm a registered medical practitioner, an aspirant of emergency medicine, and I'm currently working as a medical officer in the accident emergency department of one of the tertiary care hospitals in Pakistan. So this session is being organized to know about the uh, MRCM examinations. What is MRCM? How many parts this exam consists of? How to proceed with the process and how to kick start your journey for MRCM examinations. So this session is all about that, and I hope by the end of this session you will be able to know much more about the MRCM examinations, how to start them, how to make an account, to get your thing start off. If you are an emergency medicine aspiring physician, trying to uh, pursue your career in future in the field of emergency medicine, so that would help you quite a lot in deciding to go for which specialty exam in the future. Next, please. So the first slide, what is MRCM basically? Like many of us, being graduated from the medical school, knowing nothing much about the foreign exams, rather than knowing about just big chunks and that are already overhyped in the market. Like we know about USMLE, if we know about MRCP, and some other exams. But what is MRCM? Not much known till now date, but gradually the people are getting familiar with the MRCM examinations. So basically, MRCM is the membership of the Royal College of Emergency Medicine. This exam is specially designed to test you in the field of emergency medicine, in the curriculum of emergency medicine. If you are pursuing your career to be trained in the emergency medicine in the United Kingdom. So this exam is same as that of MRCP, but as MRCP is for internal medicine, MRCS is for surgical portion, MRCOG is for obs and gynae, and so on. So in that way, MRCM exam is basically for the emergency medicine. So specifically talking about emergency medicine, you'll have to take the MRCM examination in the early or late stages of your UK career in order to get trained emergency medicine. So MRCEM is membership of the Royal College of Emergency Medicine, as I already told you. It's a postgraduate medical qualification in the United Kingdom for doctors working in the field of emergency medicine. Okay, two things must be kept in mind. That one is the licensing exam for the UK, another is the membership exam. The licensing exam is basically known as PLAB. PLAB can just get you entry into the UK health system. It is not offering you any trained slot in the United Kingdom. You will be as an untrained, non-training doctor in any of the hospital which offer you job with your PLAB and GMC registration. But what is the good point of the membership exam? That it gains you a direct entry into the training level posts according to your home country experience. But if you are not even having that much experience in the particular field you are trying to, still it can get you a training level post. So skipping all these non-training years with MRCM and membership exams, you can directly gain an ST2, ST3 training levels spot and directly start your training in emergency medicine. So it's a very promising point of the membership exams rather than going for licensing exams. So as I've already told you, it's about all about emergency medicine. Next, please. Yeah. So we talk about the pros and of the emergency medicine exam. So MRCM offers you basic four things. Specialization in emergency medicine. The main goal of any of the exam which anybody takes in his career to be trained in either of the specialty. So that offers you a specialization in emergency medicine. Emergency medicine, please remember that each specialty carries a very big pros and cons. It have a benefits and a non-benefits relating to its workers, relating to its hectic routine. Many of the people are of the view that emergency medicine is very hectic and the duty hours are long, and you will get drained by the years you will pass on in your training career. But what I think emergency medicine is the father of the all internal medicine specialties, because being an ED specialist, you are going to treat all kind of emergencies. You cannot bound yourself to just one group age. You cannot bound yourself to one system of the body. You cannot bound yourself to one particular problem. You'll have to deal the children coming to the emergency. You'll have to deal the elderly coming to the emergency. You'll have to deal the adults, the females, the pregnant one, with the emergency situations, the RTA, the road traffic accidents, the major traumas. So each and everything you have to deal in ED. So it's a very vast and promising field, because you will be the first one. You will be the first doctor. Each and everybody having an acute problem he will come to. He cannot go directly to a specialist for his acute problem at the mid of the night, at the early hours of the day. You will be the first one who will engage with that particular person and will give him a direction, a conservative management at the moment, even a proper management at the moment in the situations like poisoning, like condition where you are the primary and the sole doctor who can treat it. So emergency medicine offer you a very promising career advancement. As by the now, the data shows that the most demanding specialty, the most demanding doctors in the UK and worldwide, even in the America, in the States, in the Australia, but specifically we are talking here about the United Kingdom. So the most demanded doctors is of emergency medicine. The qualified one, who the doctors who have cleared their MRCM examinations, are very less for now, and the slots which come up every year in the field of emergency medicine in the overall the national health services of the United Kingdom are much more. So then what happens? There are no MRCM qualified doctors. They'll have to pick up the MRCP ones, the one with vast experience in their home country, but not the MRCM, because nobody had till date known about that MRCM examination do exist. It was for the now, through these kind of sessions, that people are getting aware of. So the most demanded specialty and the most promising one is the only one, that is emergency medicine. All other specialties can get saturated by time, because everybody is going for the same thing. So definitely you are competing with more. In emergency medicine, there is competition, but the chances of you getting a better position, a better hospital, a better training opportunity is more, because the slots are more, the demand is more, and the supply for now is very low through the MRCM route, not through the other routes. So global recognition. Definitely, if you have passed your MRCM examinations, so you will be recognized globally as an ER medical specialist, that is emergency medicine physician. And wherever you will go with a trained career in the emergency medicine through the MRCM examinations, they will accept you. They will offer you good places. They will offer you good incentives in any corner of the world, wherever you will go. Because I already told you about the demand and supply situation nowadays. You'll have to look that demand is more of the emergency medicine and the supply is quite low from the MRCM examination. So the filter out is very low. So if you filter out through MRCM examinations, the promising career which will wait for you, you will realize it with time that though the working hours are more, though it's a slightly more bit hectic, but I won't say it's hectic. It's adventurous, treating different kind of people at the moment, with different age groups, with entirely different problems. One would come with the road traffic accident. The second one coming to the AD will be a pregnant lady with labor, and you'll have to treat her too, not rather than referring her to gynecology, not referring your child to the pediatrician, because it's an emergency acute situation and you are the one to treat it. So patient need improvement. And I've told you that a patient having an acute problem with an acute onset, you are the doctor he's looking up to cure him. If not cure, if not possible, the cure is not in your hands, but you can provide him a conservative, asymptomatic treatment for now, for a day, for a night, in order to stable him vitally and let him to be referred to a particular doctor at the very onset of morning. So the patient, the relationship which you made with a patient when coming to the ED with an acute problem, he's in distress. She in any age group, it's in that person is in distress, uh, 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 and he is looking up to you, that you will be the one who will ease her pain, lessen her misery, and let her get some conservative symptomatic relief for now. And if possible, you can treat her. So the relationship, the bond should be very strong. The approach towards the patient. So these all things will come you when you will be a trained emergency medicine physician, when you will be a trainee in the field of emergency medicine. What we have seen in our countries and what you will see in the UK is quite different. The emergency settings are quite different. They work on the triage basis. They run codes for each and every case they are encountering in the ED. While unfortunately these things are not much developed in countries like Pakistan or some other, but in the UK it's a triage based, it's a code based, and you have a proper team of paramedic staff who is that staff is transferring the patient from that particular location to your hospital and informing you about each and everything minute by minute till the patient reach the hospital, and you have a very clear image of the patient in between in your mind, that that patient is the case of particular thing, and this is her current status, and what will I have to do. You inform your team, the team is ready to receive the patient, so the plan is quite ready in your in your mind. You have just to act it. So that bond which you make with the patient when the patient arrive in the ED is something which will be a very rewarding one. So no, the being a doctor, it's all about how you treat your patient and how you are rewarded back through the lessening of the uncomfortableness and the misery of your patient. So that sense, that sentiment is quite much more in the field of emergency medicine rather than other specialties, because other specialties are not emergency related. You are the one who is an emergency medicine physician, and you have to deal with the acute condition. Acute conditions are much more painful, have much more mortality rate, and so you are the one who can overcome all these and lessen the burden of the patient. So these are some of the major benefits. Rather, apart from this, you name it, an emergency medicine through the MRCM examinations, you can have that through your MRCM examination trainee in the UK. Thank you. Next slide. So, coming to the basic infrastructure of the exam, so MRCM examination basically consists of three parts. Um, you start with MRCM primary exam, then MRCM intermediate or SBA, more commonly known as the short. At first, it was known as the uh, short basic answer questions. Okay, let me answer the questions too. Coming to your questions about the MRCM Part 1 exam. So MRCM have three parts: the MRCM primary or part 1, MRCM intermediate exam, and number 3 is the MRCM OSCE. So the first two part are the theoretical exams, and the last one is the OSCE exam, which you have to perform. There is the clinical stations. For now, we'll focus mainly on our MRCM primary exam, because most of the candidates are new and they are yet to decide about their MRCM journey. So MRCM primary is our main focus for now, and then the slight touch the MRCM intermediate and the OSCE examination. But for now, MRCM primary would be the more hot topic to touch. So MRCM primary is basically a theoretical exam. a theory exam which consists of just MCQs, offering you MCQs. There is no short best answers, no clinical scenarios to write the diagnosis with pencil or pen. It's just MCQs, and you'll have to answer them in the very particular time, which we'll discuss in the next slides. And we'll discuss the cutoff score too. So MRCM primary is a MCQs
Sir,
based exam. Yeah.
yeah, sir, let's do question and answer at the end of the session.
Okay.
Thank you.
So MRCM primary is a theoretical exam, but it's MCQs based. Not let it not confuse with the short best answers. And MRCM primary, it's a computer based MCQs exam that includes a single best answers. Single best answer means it's an MCQ. You have to pick the best answer in the MCQs which are given in the column of the particular question. So the question consists of 180 in total. So the question, the MCQs which you'll have to answer in the exam will be 180, and the time duration will be 3 hours. So it's 180 minutes too. So 180 MCQs in 180 minutes. So 1 minute per MCQ is given in the exam duration. Next slide. Okay. So now let's talk about the calendar and when the window will open for the MRCM exam, primary exam. So um, the first exam will be on the 21st of May 2024. That will be the day when you will be taking your exam. And so that's the exam day, remember. That's not the window opening day. That's the exam day, the day which you will take your exam. That will be 21st of May. But when will the window will start? The opening window will start for the booking of the exam. That will be between 21st of Feb to 28th of Feb, 1 week. So from 21st of February 2024 to 28th of February 2024, the RCM website, the Royal College of Emergency Medicine website, will open up their registration process through which you can apply and book your exam. And what about the centers? So the center is offered in UK for the candidates who are living in UK and worldwide through Pearson VUE, centralized offering center policy. They offer you a center at your home country if it's available with the Pearson VUE and registered. So the exam centers are available worldwide in the UK and worldwide in almost in each and every country where the Pearson VUE is functional. So they are offering MRCM examination centers in your home country too. So that won't be a problem. But what the problem is that you must keep in mind that whenever you are booking with the exam, hello, Raiha.
We can hear you, sir.
Sir, just wait a minute. There is an internet problem.
Yes, there is. Okay. So let's not wait for the presentation. We'll discuss it in this way. So we were talking about the MRCM primary exam. So I have told you, the exam is conducted 2 times a year. That will be in the May, 21st of May will be the day you're taking your exam, and the second exam, the second date of the exam of the primary one will be in somewhere in the October. So from 21st of February to 28th of February, this will be the opening window for the registration process of the May exam. So in this time, you will have to make an account on the RCEM website, that is the Royal College of Emergency Medicine. You will have to make a website, your account on the RCM website, your proper details from where you are. So that's a full column of your personal details. You'll have to make the account. on the very right time when the window is open. You don't need to make an account before the opening of the window because it's useless for that. So when the window open, you directly go and open an account, and then you open an account, you go to the booking of the exam column on the RCM website. When you go for the booking of the exam column on the RCM website, but do remember you will find the MRCM primary exam booking window available till 28th of February for the May exam. So from that, you can book your exam, do your payment, and you will be booked for the date of the exam. But do remember that the RCM website do crash sometimes, and you won't be able to move forward in your application process. So what to do for that? That whenever such issue happens during the registration process when you are booking for your exam, the website crashes. So rather than waiting for it to reload again, that's not going to happen. So what you can do, you can just scroll down to the very least bottom of your screen, and then there you will find that your application is actually progressing, but the upper portion of the website is crashed. So whenever you find the website is crashed, you directly scroll down to the best bottom of your screen, and there you will find your application, and from there you can enter the data and progress. So that's the way you can progress your exam, because most of the time the website is crashed when the window is open for the exam booking. So please keep that in mind. Otherwise you won't be able to register for the exam, and you will just wait till the website do reload again, but it's not going to happen. So something like that happens, just scroll down and to the best bottom of your screen, and there you will find your application. And then from there you can add the data of which they are asking from you, and you can proceed your application. Once you are done with the process of application and booking and payment of the exam, they will email you about the booking of the exam. Okay, so we were talking about the booking of the exam. So once you are booked with the exam, they will they will send you an email about your booking. But once they send you the email, that's not the end of the process of the registration. Once they send you the email, they'll send you again an email after a week to let you know that you have to book a slot in the center in your country which the PSNV is offering for the MRCM primary exam. So after 3 or 4 weeks, or after a month before your exam, the PSNV will send you an email with the link in that, which will tell you that please open the particular link and book your exam center. Through a RCM website, you book your exam, but through the Pearson View email, you'll have to book your exam center in your country. And that exam center just vanish in the matter of seconds. With the blink of the eye, the centers got finished. So you should be very promptly, you should act very promptly and quick while booking your exam center. That's a very important things. Most of my friends have missed this exam died because of the November died, because they were not able to book a slot in their nearby exam centers. So the Pearson View email is very must in order for you to take your exam in your home country. They will send you an email. You'll have to click the link and book the exam center available in your country. So that's how you will end your registration process and exam booking, and then you can relax and study for the exam. So these are the registration process is though it seems very hectic and fussy, but I have made you clear about the website crash issue too, that happens very commonly with the people. And after RCM registration, the Pearson View registration will be pending too, so you'll have to be very vigilant for that, that you can get email anytime from them, and you'll have to book your exam center very quickly. So now coming to the eligibility, the cost of exam is almost 324 pounds. So it's not much costly, and so it's not much that costly as compared to other exams. So and they won't charge any extra dues for the exam centers which you will be taking exams, so that all will be included in your this particular fees. Though some international taxation do cut from apart from this, so approximately you can count it to be 340 almost, because of the taxation and international laws. So they cut almost a good amount of tax from you if you are not a taxpayer in your country. So now coming to the eligibility of the MRCM exam, you don't need any experience in the emergency medicine for the MRCAM primary exam. But what is the requirement? The requirement is you must be a graduate of a med school. You have a primary qualification degree and 1 year of house job, 1 year of your post graduation year as an internship year, which we call as an internship year, an observership year, or a house job, which you have worked in any hospital as a junior doctor. So that is the primary requirement for the MRCM. If you have just qualified the med school, you have done your graduation from the med school, but you didn't uh, did your internship year, you're not eligible to sit in the exam. You'll have to be eligible after graduation, 1 year of internship, 1 year of observership, and then you can sit in the exam. You'll have to provide them details of that too. So that's the basic requirement, but no prior experience in the emergency medicine is required for the primary exam. A candidate will be eligible to enter the MRCM prime examination provided they hold a medical qualification approved by the General Medical Council for the purpose of registration. But for in order to sit for the exam, apart from the primary medical degree which you have from your med school, you have a post graduation internship year two. Before that, you cannot take your MRCM primary exam, even the primary exam. Though emergency medicine experience is not required, but the internship year is required for the MRCM examinations. All right, next slide. So now I'm breaking down the 180 MCQs into various subjects which cover the more major and the minor portion of the exam. So the major portion of the exam basically consists of two systems, that is anatomy and physiology. Anatomy covering 60%, 60 MCQs, and the physiology also covering the 60 short best answers or MCQs. So it almost make 120 MCQs out of 180. So covering almost, you can say, more than 60% of the exam MCQs is from the anatomy and physiology. After that, you have MCQs from the pharmacology, and then microbiology, pathology, and the evidence-based medicine is the least tested one in the exam. And anatomy and physiology, the focus should be more on these two subjects. Then if you aim to score more in the exam, so you have to score more in the anatomy physiology, and if you score more in the anatomy physiology, you'll be on the safe side to pass the exam. So the major chunks should be covered very deeply, thoroughly, and each and everything should be studied very carefully of the major portion of the exam, that is anatomy and physiology. And anatomy and physiology, you in this curriculum of the emergency medicine, please remember that you just have to cover the emergency medicine related topics, yeah, systems which are tested in the emergency medicine. You don't need to do all of the anatomy, all of the muscles, all of the nerves, all of the arteries, their route, their supply. No, the nerves, the arteries, the muscles, the bones which are related somehow to the emergency medicine, you'll have to do it. And for that, the RCEM have done a very great job. They have made a curriculum, and they do not divert their track during the examination. So you'll get the question directly from the curriculum. So stick to the curriculum, do topics curriculum wise, and you will get through it. So anatomy and physiology covering the major, followed by pharmacology and microbiology, then pathology and evidence-based medicine. Next, please. Okay. So MRCM Part C, I guess we have skipped Part B of the intermediate exam, but let me give you an overview of the part B. So, and after you passed your MRCM primary exam, you will be eligible to sit for the MRCEM intermediate exam. Intermediate exam is also held twice a year, and you can see the window period in the calendar or at the RCM website, that when the window opening, when there is the window opening, and when the exam will be conducted. As compared to the primary exam, the intermediate exam is more clinical. The difficulty level is more than the primary exam, because primary is basics, and intermediate you will be tested clinically in the various subjects. So it's a more clinical exam. You will have same only MCQs, but you will be having two papers. Paper A consisting of 90 MCQs, and paper B consisting of 90 MCQs. The scenarios are long. You're tested more deeply in each and every system. So it is also covering the major systems like cardiology, orthopedics, major trauma, poisoning, and some other specialties, and you will be tested very deeply in them. So the time duration to prepare for the exam is more than the primary. The difficulty level is more than the primary, and the study should the dedication should be more than the primary for the intermediate exam, because of the difficulty level and more clinical touch than the primary. uh, please please stay back. No, rewind the slides. Yes, this is, that's all right. So, as I've told you about the MRCM intermediate. So, MRCM intermediate, you'll be only eligible to sit for the MRCM intermediate when you have qualified the primary exam. And for intermediate two, you don't need any experience, any exposure in the emergency medicine. That's not a requirement for the intermediate two. For intermediate, the only requirement is you have passed the MRCM primary exam. That's the only requirement for MRCM intermediate exam. Next, please. So this is the breakdown of the topics of the questions which are being tested in the MRCM intermediate exam. The SLO is the subject learning objectives. So you have seven subject learning objectives which will be tested in the exam. The major portion is of that it consists of 55 questions. This complex table patients, these 55 questions will include a question from the cardiology, from the urology, respiratory, dermatology, peds, gynae, and ops. So each and every system of the body, you will get questions in the SLO, complex stable patient group. So these cover the major portion, and you'll have to focus more on these topics in the intermediate exam. Followed by the resuscitation. Resuscitation means that you'll be getting questions from the major trauma, and they will be asking about the first line management, how you will resuscitate the patient in the emergency room regarding following a major trauma. So you'll get questions on that, and will be tested differently from that. Number third is the injured patient. Injured patients will have environmental emergencies which the patient have experienced, and they will ask either about the treatment, either about the pathophysiology of the particular condition, or either about the complications, either about the management, either about the drugs which you'll have to give in that very particular condition. So they can test you in each and every way. Number SLO5 will have pediatric emergency questions. Children coming with the poisoning, with foreign objects, with any other emergency. So you'll have to answer that questions too. So you'll have to cover the pediatric emergency too, and it carries 25 questions. Procedural skills include the procedure which are being carried out in the ED, like intubation and the drains which we can place in the ED, and uh, a lot of procedures can be done in the ED. So that all procedures will be tested in the exam, either through a scenario or through a proper question. So you'll have to be vigilant enough to answer that which procedure the examiner is referring to, and what he is asking you, and what you and how you are going to proceed with the answers. So the skills, the procedures which you encounter in the ED will be tested here too. And the last one is the complex and challenging situation. This is the most difficult part of the MRCM intermediate exam. The questions are very, very tricky, but through your multiple taking multiple challenging tasks, you can answer this question. In this question, they will ask you about your response, about being you a primary physician of the patient. What will you decide further? They'll tell you that the patient have been given this for cardiac arrest, but the patient is not responding. Now what will you do next? This is a very complex, challenging situation for you. And being an emergency medicine physician, they are testing you of your nerves, that how strong your nerves are, and what you're going to do next. So you'll have to study all the algorithms for that. You'll have to be vigilant enough. You have to be vigilant enough to have a very stepwise approach to each and everything, each and every acute emergency. So if you go stepwise, you won't miss anything, and you can add on by covering each and every step. So if they have covered four steps and asking about you the fifth one, so if you have studied the algorithms properly, that won't be any issue for you. So intermediate exam is quite challenging in a sense that it's more clinical. So that's all about intermediate. We are not much discussing about the intermediate for now, because most of you are new candidates and primary should be the more focused. So intermediate exam it was a brief overview of the intermediate exam. Next one. So the standard book for the uh, MRCM examinations, especially the not the primary one but the intermediate one, is Oxford Handbook of Emergency Medicine. There's a very small book, even you can take it in your pocket, but it covers almost each and every topic which will be tested in the intermediate exam. So this book is mainly for the intermediate exam, not for the primary, because it is a clinical book and it covers the clinical topics which are tested in the MRCM intermediate exam. Now coming to the MRCM third part, that is the MRCM OSCE. In OSCE, you will be in OSCE, the stations are there. This is a clinical exam. You don't have to be answering the MCQs anymore. You will be tested clinically, physically, by giving challenging situations, by seeing your procedural skills, by seeing your approach to the patient, by seeing your counseling. So these all will be counted. There are 16 stations, and each duration for the station is 8 minutes time. So as I've already told you, the stations will be revolving around from the clinical side. Then we're including clinical examinations, challenging situations, and to procedures and to communication. That will be counseling or calming an angry patient. So each and every aspect of a perfect doctor for the emergency medicine will be tested in the OSCE sessions. So you have 8 minutes for each session, each station, and you will have to be quick, vigilant, and your reflexes should be strong enough to readily diagnose, to readily treat, to readily perform the required the procedure from you in during your exam. But for now, OSCE should not be your main concern, because all of you are quite new, so the primary exam should be the main concern, or at most the intermediate one. So this is the window period for the year 2024 for the MRCM OSCE. So the first exam, the first date will be from 3rd to 14 June 2024, and the second will be from 2 to 13 December. And and for MRCM OSCE, the centers are in London, in India, and in Malaysia. There are three centers which I remember for now. These three centers are conducting the MRCEM OSCE examination. So if somebody is living near Malaysia or India, so he can take exam in their home country, or nearby countries can travel to these countries too. But if not, the UK is the ultimate option in which you can take the exam. Next, please. So this is fees for the MRCM OSCE exam. That's for 88. It's almost uh, 120, 140 more than the primary and the intermediate. The primary and intermediate fees are same. It's almost 324. So the fees are same for the primary and intermediate exam, but it's a bit high for the OSCE examinations. Next, please. I'll skip the OSCE. Let's go forward from there.
Sir, go forward, sir.
Yes, next slide. Next slide.
Next.
Yes, this should be. So, after giving a brief overview of the three examinations, stepwise from primary to intermediate to the last one, the OSCE one, what I am focusing right now is on the primary examination. I want you guys to understand that what basically comes in the exam, how you prepare for the exam. That is the main topic for us. Now, okay, let me revise. Let me revise it for you. MRCM examination have three parts: primary, intermediate, and OSCE. For now, our main concern is primary, and we'll arrange a next session for the intermediate and then for the OSCE. But it is with time. For now, the first focus should be the primary. The primary examination, your eligibility criteria is very important. You must be a graduate of the medical school and you have 1 year of internship. That is the eligibility criteria for the primary exam. Okay, after eligibility criteria, we come how to book an exam. You go to the exam will be held on 21st of May 2024, and then next exam will be held in the month of October. So for the May exam, the booking window will open from the 21st of February to 28th of February 2024. This is the booking window. When the booking window will open, you guys will go to the RCM website, that is the Royal College of Emergency Medicine website. You will make your account, and the website do crashes a lot of the time, so you don't need to be panic. When the website crashes, you scroll deep down to the bottom of your laptop screens, and there you will find your application is actually being in progress. You put the data from there and progress from the bottom. So that's how application will progress. Once you are done, you will get an email that you have booked the exam. You even done the payment in the RCM exam booking process too. You do the payment, you will get an email that you have booked the exam. Then you wait for the Pearson Review to send you an email to book an exam center nearby available in your country. That is the most important thing, because centers finishes very quickly. So you have to be quick enough to and vigilant enough to keep an eye on your emails and book the right exam center for yourself. And the link for the center booking will be provided in the very email sent to you by the Pearson Review. So that's how you book your exam. After you book your exam, you need to prepare for the exam. So 3 to 4 months is the ideal preparation time for the MRCM primary exam. Some people get it up to 6, some people can reduce it up to 2.5 and 3, but 3 to 4 is the ideal time to prepare for the exam. Now, talking about the resources. Remember, when I took my exams, when I took the MRCM primary exam, the only resource which I found very helpful and the gold standard was MRCM Success. MRCM Success is basically a question bank of more than 3,000 questions with the very deep explanations to each and every topic. It is being created by the emergency medicine doctors who are currently working in the UK. So this question bank is created by them. So MRCEM Success subscription, this question bank is the gold standard. It should be the gold standard to all of you preparing for the MRCEM primary exam. When you take the subscription for the MRCEM Success, there are 2 columns. One is the question bank and the other is their library. In the library, you just have the notes available of each and every topic for anatomy, for physiology, and then subtopics in the anatomy, subtopics in the physiology. Then it's same in the pharma, and each and every topic which are tested in the MRCM primary exam. You first read the theory of anatomy, and then you do the system-wise MCQs of the anatomy. And when you do the MCQs, you mark an answer. If it's right or wrong, you get below the answer, you get a lot of the explanation that why this answer is correct and why this is not. And then below that, you have all detailed overview of the very particular topic from which the MCQs is being asked. So it's a very, very gold standard, though it's a bit lengthy, but it gives you a very deep and a thorough overview of that very particular topic. And you'll be able to answer the questions of the anatomy, physiology, pharmacology if they are being tested in that in your exam. So MRCM success subscription is the gold standard. Apart from that, you can take MRCM expert subscription, but they are just dealing with the recalls, and they are just giving you recall sessions. They have recalls from the past exams, and it will help you in understanding and that what kind of questions are asked and what questions have already come in the exam. So MRCM expert is the second it should be the second choice of question bank for the recalls. And apart from them, you can find recalls of all the previous years and do the recalls topic very much in detail. So the first thing should, when you start the preparation for the MRCM primary exam, you took the subscription of the MRCM success. You try to complete it in the first 2 months. When you complete the MRCM success question bank in the first 2 months, it can easily be completed in the first 2 months. After that, what you do, you you save or you mark the important topics from anatomy, from physiology, from pharmacology, from microbiology. And in the second run, that is the third month, you do that important topics. You do the hot topics. And in the last month, what you do the recalls. You first do the recalls, and then you again study the recalls topic in details. So that's how you will maximize your preparation, and you will maximize the focus on the topics which are tested again and again in the exam. So the map should be a MRChem success subscription in the first 2 months, followed by the hot topics which you have selected and marked important. After the recalls in the first 15 days, and the recall topic discussion in the last 15 days. So it's almost 3 to 4 months duration. You can extend it, you can reduce it according to your time dedication each day for the MRCM examination preparation. So ideal time 3 to 4 months. MRCM success subscription should be the gold standard question bank. Apart from that, you can take MRChem Expert, which is just having recalls of the previous exam that can help you too. But if you can find recalls from any other place, so that would be sufficient enough. When the time come, when you all are done with the booking of the exam, we will conduct a session on the MRCM recalls just before a month of your exam, and we will do all the recalls and get that topic retestify again and again. We will rectify them, inshallah, to maximize your preparation. So that's the end thing we'll do, inshallah. We'll do the recall session, but you should be able to understand that what should be the roadmap. The roadmap is just make your theory strong. You cannot just rely on the recalls. So anybody relying on the recalls will fall in the pit, because you should remember this thing very clearly in your mind that the pattern is changing. MRChem primary exam is not as much as simple as it used to be. The last time when I take the exam, the pattern was completely changed. They're making questions more difficult, more clinically oriented, and they're testing you more deeply in that. So for that, you need a very, very deep theoretical knowledge. So for that, MRChem success will give you a very deep overview, and you will be able to answer that questions in every way they have asked you. So then won't be a problem. So the roadmap should be very clear for you, and the recall session will be conducted by the maths tutors, inshallah, at the end of the before your exam, whenever you are done with the booking. So we'll conduct a recall session, and that will maximize your preparation. But first, MRCM success subscription, your own study, and then the important topics which you've already marked in the MRCM success, which seems important to you, and then the recalls in discussion with this kind of webinar we'll conduct it, inshallah. So that was all about the MRCM examinations. And if any questions, you can ask me now. You can ask in the voice or you can type them. I'll answer them.
So we have some questions in the chat box.
Yeah. I'm going to them. So,
Yeah.
how long are MRCM exam results valid, and what are the limitation condition associated with the duration of the validity? So the primary exam is valid for 2 years. You'll have to pass the intermediate in between them. That's how the exam goes. You pass one, you have time to pass the second one, and then you pass the second, you have time to pass the third one. That's how you progress in the examination sessions. Okay. What are the key topics covered in the MRCM Part 1 syllabus, and where you can find detailed breakdown of the curriculum? The detailed breakdown of the curriculum can be found on the RCM website. You go to the Royal College of Emergency Medicine website, they have own website, and then you can find the curriculum for the primary exam. They have very clearly broken down that what topics they are testing you, and you can prepare, you can make it as a blueprint and study for your MRCM primary exam. So it is available on their RCM website. What is the passing criteria? Okay, that's a very important question. I have missed it. So there's a good news for you guys that the cutoff marks for the MRCM primary exam is very low. Uh, at most, the highest cutoff mark were 112. That were 112 were the highest cutoff marks in the previous sessions, and the lowest was 102. So you have to score somewhere between 110 to 120 to pass the exam. Like in 180, you have to score 110 to 120 to pass the exam. It seems very doable. So the cutoff mark is low, and you can easily pass the exam with a very decent preparation. So the cutoff mark is very low. So the 110 to 120 would give you a very good go to pass the exam. So that's the percentage. So I have already given the historical pass rates for the MRCM exam, primary exam. So the highest went to 112 and the lowest went to 102, and it fluctuates between them. But sometimes it do get higher and it do get low. But to be on safe side, you have to score between 110 to 120. If you score around 120, you are on safe side. You can pass the exam. Yeah, the step-by-step process I've already explained how to proceed with the eligibility criteria to start your MRCM journey. And deadlines, yes, you should be aware of the deadline. You should mark that in your phone calendar that when the booking window will open for the MRCM primary exam. When the booking window will open, you have to book your exam in the very particular time. Okay, Dr. Hamza, can we just do the recalls? As I've told you, Dr. Rehan, that recalls are very late things to do. You cannot just rely on recalls for the MRCM examination because these are the Royal College exams. They are the membership exams, and you cannot just waste your time, your energy, your efforts, your money on just relying on the recalls for the exam. So it's better to prepare yourself theoretically first to MRCM Success Subscription Question Bank, and after that, in the last month, we'll arrange a recall session and we'll try to cover as many recalls as we can, because recalls are discussion thing that cannot be ratified. So you have to discuss the recalls so to clear your roadmap. So we'll arrange a recall session, inshallah. You're a final year student, so you can start your preparation somewhere mid of your internship year or house job, because you need a house job year, internship year, for the exam. After internship year, you can apply for the exam. So in between, uh, around when half of your internship year is passed, then you can prepare for the exam with a very low dedication time, so you can prepare well. And one other important thing, OET is not required for the MRCM primary exam. If somebody haven't taken OET, still he can or she can take the MRCM primary exam. OET is only required when you are registering for the GMC. That will be after your OSCE, yeah, before your OSCE. But for primary and intermediate, OET is not required. MRK, after passing the MRK primary exam, the P is a very late thing to discuss upon, because you have to clear the at least MRCM intermediate exam. So then you can find some exemption routes to enter the GMC. Recall session are definitely good for to rectify your preparation. The recalls are a must because the exam questions do repeat. They do repeat differently, but they repeat. So recalls are very important, and, and the only way to study recalls more thoroughly, because recalls are mostly poor stems. They are poor recalls because somebody have written them, and the stems are very poor. So you have to discuss that topic. And as I've told you, maths tutors will inshallah arrange the session almost 15 to 20 days before your exam for the recall session. What will happen if someone missed the booking seat in his home country if the seats were taken? If somebody have missed the booking seats in his home country, so he can email the Pearson View to change his country of sit from where you are taking the exam to any other nearby available, and they can then again send you the link of the nearby countries exam center available, and you can book the exam if the seats are available. So they can do it, that's not a worry, but try to book your exam at time. Any other questions which I'll be taking for now, or is all? So basically, don't overburden yourself. It was just an overview. When the exam booking time will come and you guys will be ready to book your exam. So after your booking of the exam, we'll conduct a very detailed sessions on the MRCM primary. We'll discuss each and every topic, then how to prepare, what they ask not. So it was just an overview to make clear things for you. As time goes on and the exam and you guys are done with your exam booking, so we'll progress in the primary more deep, and we will study more things in it, inshallah. MRCM examinations are typically held almost in every country through particular centers provided by the Pearson View. So they have a contract with them, and if the Pearson View is currently functional in your home country, so MRCM will be conducted in your country. So it's conducted worldwide. Exam centers are not an issue, but booking them at the very right time is an issue. So as I already mentioned you, and even before the window period opening, we'll conduct a very short session or a video on the exam booking process. So you guys won't panic, inshallah. So I guess that's all for the question answer sessions. I'm not getting any more questions, and I hope everything will be clear to you guys. And the next sessions, please keep your questions ready. Any question you have in your mind, and we'll discuss it, inshallah.
Thank you, Dr. Hamza, for the wonderful session. I think we have cleared all the queries.
Yeah, thank you. So that's all for today, I guess. Should we end the meeting now?
Yes, sir.
Okay. Thank you. Thank you.
Allah Hafiz. Bye bye.